Hi, Leonora. How are
Hi.
you? It's really good to see you and introduce you to AAPI Women Leads audience members right now. I am excited to share with AAPI Women Lead, all the folks that are listening. This is Leonora Willis. She is one of our favorite people, by the way. She is American Samoan born. She's a yoga instructor. She's a doula. She's a co-owner with two other women of a yoga studio in Oakland. And she's also an amazing badass. So we want to welcome her to this community care series. She's going to talk to us about a couple of things and more specifically about being a doula.
Yeah, definitely. So with moms who are close to their due dates, there's a bit of anxiety and general feelings of unsurety about what their future birth experience can look like, might look like, how they want it to look. And different kinds of births can happen, right? We can birth at home, we can birth in a birthing center, we can birth in a hospital. And so people who are about to give birth are really considering all of their options. And their options oftentimes are predicated by insurance and their capability of having access to that. And that narrows their scope as to what kind of birth that they can have. So typically that's initially their first consideration that they have to take in.
Okay.
Yeah, and that's really challenging. Not a lot of insurance will cover midwives, and depending on pre-existing conditions, how high risk the medical establishment considers birthing people.
Mm-hmm.
That's how they're allotted their options. And so, yeah, they have options that they have to consider.
So what's going on with them right now with COVID?
So specifically with COVID, there are, if you're considering having a hospital birth, there's in the Bay Area right now, hospitals in general are very quiet. They're kind of perched and ready with tents outside, but in general, for influx of COVID infected, or just for testing, or so it's super quiet in the hospitals, which gives about this kind of eerie feeling. And the CDC has recommendations and in place that for obstetrics, and that's online for people to know. We saw in New York a few weeks back that birthing partners were not allowed in the room, which was a human rights violation. And so they quickly retracted that so that birthing people have someone there as support. And that was kind of the initial prompting for birthing people to find ways to advocate for the kind of birth that you really need and that you want to see for yourself in light of all that's happening right now. Your desire to protect medical health, professionals, right, when you're going into the hospital, but also to still have the kind of birth that you want. So there are a lot of considerations. The CDC is one of them. There's another organization in Britain that has outlaid some, and I can't remember the name of the organization. It'll come to me and I'll have to share it with you. Other kinds of guidelines for birthing people within the hospital setting, that's more conducive to humanity. We put it that way. Yeah.
I would imagine like right now it feels really frightening under these conditions, and probably, like you outlined, eerily kind of lonely. And so I know that doulas, one of the things that I've learned is that you all are kind of the base for, you're like, you hold it down you like take care of the mom as they are doing what they need to do, like the entire environment.
Mhm.
So given, you know, these conditions, can you tell us what it is that moms are, what they need now that they're in this situation?
Yeah. Yeah, because there are so many considerations leading up to their birth. It's really important that they research and they find out what the situation is within the location that they plan on birthing.
Okay.
So different hospitals have different policies, and knowing what they are is going to help them be able to be present when they are in labor, because they'll have like ticked all the boxes for figuring out what the scenario could look like,
Mhm.
and then made a really solid plan for what they want within the framework of how things really look.
Yep.
So what to pack, it's to take to the hospital. Having a doula I've never realized the importance of having a doula. I am a doula
Mhm.
in these moments right now, in terms of planning for your birth, and envisioning, what that will really look like, and all the intricacies of what has to be figured out in order for you to have that birthing experience that you really want, that vision of how you imagine your birth happening. Doulas are helping birthing people stay home
Mm.
longer so that their time in the hospital is super minimal, and then everyone's exposure is lessened.
Mm.
Uh, and uh, because of the way that our health system is and our hospital system is, there's less intervention if you can stay home longer. uh,
Mm. Mhm.
and and that oftentimes leads to a birth that people who want to birth, not like without an unmedicated birth,
Right.
that that's just so much more possible.
Okay. Can
Mhm.
you share with us a little bit? I hear you saying that they need to do the research around their birthing facility and then prepare themselves accordingly. I know that doulas teach us so much about and hold so much space for the mothers and the families involved. Can you give us a little bit of a taste of some of the things that you would do, and that others who are watching, if they can't have access to a doula, what are some of the things that you would do to keep somebody home so that they can be most optimal for the birthing experience?
I love that. Yes, I definitely can. Um, yeah. So, childbirth education classes.
Mhm.
Um, a lot of hospitals and birthing centers and midwives have had to limit and alter those, but they are still available online. You can find a childbirth education class. Knowing what's happening in your body when you're in labor and understanding that, like all, your partner, your birthing partner, because you can have one to go into the hospital right now in the Bay Area.
Mhm.
So the two of you knowing exactly, as much as you possibly can, educating yourself in those childbirth education classes is setting yourself up for the birth experience that you hope for. And that's primary of what I would suggest. And there are free resources online, and there are also pay resources online, so that you can you can have a childbirth education class, via Zoom, like many education courses have shifted and moved to.
Mhm.
Um, and that kind of preparation is tantamount important. I want everyone doing that. There's free YouTube videos by someone that I really highly respect, in evidence-based birth, evidencebasedbirth.com. And this woman is a nurse and a PhD holder. And so in 5 videos, I think it is, she lays out COVID, um, and hormones and anatomy and what's happening in your body, the stages of birth, so that you really feel prepared after that free tutorial, free education series.
Okay.
So that's definitely important.
Okay, these birthing classes. And then I also know that you teach prenatal yoga at the yoga studio that you own. I've taken one of your classes before, and it is amazing the way that you get people to drop into their bodies. Are there a couple of cues or things that people who are, getting ready to birth need to pay attention to, in addition to probably taking some online classes?
Yeah. I mean, I think many prenatal teachers, yoga teachers will tell you that preparing for birth is like preparing for a marathon,
Okay.
um, and seeing it that way as a step-by-step process, a daily practice where you are preparing your body and strengthening, you're preparing your mind and staying centered, you're preparing your body and opening, and really ultimately, like with yoga, you're constantly coming to yourself, checking in with yourself, seeing what's happening within yourself,
Mhm.
and that skill taken into labor is it was like what you need. You notice the shifts that are happening within your body. You learn how to trust that with practice, because that's not easy. And ultimately, that is very helpful for, again, having the kind of labor and birth that you hope.
Okay. So I'm hearing a number of things. I'm hearing the conditions are a little bit challenging right now under COVID, to say the very least, but some things are being done to make it a little bit more easeful under a global health crisis. And then I also hear you saying that ways to prepare would be to take some classes online around birthing. And then I hear you also saying, prenatal yoga or centering practices that are, centering yourself and knowing yourself through this process, guided centering practices are probably going to be really helpful. Or that's what I'm hearing, right? Am I right
Yeah,
about that?
with breath practice too thrown in there.
Say that again.
With breath practices as
Breath
well.
practices, yes, because I love your breath practices. Are there things that people who are supporting mothers right now need to know? What can they do?
Yeah. It's a really tough place to be, obviously, right? To be pregnant can be a tough place. But I think also, if you're supporting someone who is pregnant, this is really, it's really one of the most beautiful things. Being pregnant and having a baby and growing your family. And there's nothing I can imagine um, better. A baby, yes. So remembering that, right? Remembering that the joy in this is that we're having a baby, and reminding your partner of that in little ways, in big ways. And that joy is what can sit at the center of the anxiety that we are, blustered around with. Um, and I think that kind of love that you can give your partner is really helpful. And for people who are, solo parenting and solo birthing, again, finding a partner that you can trust and count on,
Mhm.
is that can help you through this process, is important. Whether that be your mother, an auntie, a
Mhm.
doula, whomever that is, getting somebody solid be there for you in these kinds of ways is going to be helpful.
I love that. I love you emphasizing and reminding us the importance of the joy in bringing life, um, generally speaking, and then especially in this moment. I love you talking about the need for being in relationship with others that you trust in this pivotal, really, really important moment. So I want to definitely thank you for helping us to understand how the individual mom, what they need, what's going on with them, and then how we can support them by letting them know they're held and it's a joyous occasion. Um, I actually wanted to throw something in that I didn't tell you about. I know, AAPI Women Lead has been really big on centering our Asian and Pacific Islander self-identified women and girls. You happen to be one of the biggest leaders in yoga and that identify as such. I just wanted you to tell us, like, what are some of our like strengths as Asian and Pacific Islander community members in expanding or contributing to this world of being grounded and held. What should people know about our different cultures, and I guess maybe it's holistic health or just taking care of ourselves and each other?
Mm-hmm. Yeah, I mean, I think you're saying it. I think you're saying it, and I'm in agreement that it's taking care of ourselves and others. And in my experience, the two go hand in hand. When you take care of others, you are essentially taking care of yourself.
Yeah.
That recognition of the interconnectivity, as Pacific Islanders, you know, that we're dependent on one another
Mm.
for our survival, for our happiness, for our spiritual growth,
Mm.
for our support, and 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 the wellspring that runs within each of us individually has been created because we've been born and raised with that as in our mentality, with that as, like as in our DNA.
Mhm.
Um,
Mhm.
and I think using that and pulling from that, and you don't even have to use it and pull from it. It's there. You
Yeah.
just have to be it. And when I look to my ancestors, I'm asking, how can I do better by you? And then I get the answers, and so I listen, and that's essentially how I understand myself as a someone.
Yeah, I think that is so beautiful and so helpful for people to understand. A lot of the healers and kind of holistic health practitioners that I've been talking to from Black, Indigenous, and other communities of color have been saying similar things around touching base with their ancestors, touching base with each other as a part of our kind of cultural politics, you know, and ways of being in the world. So, oh, and the other thing I wanted to say is I have been to your yoga studio where it's like family. Where like there's so many people in there and they all are so loving and kind. And I can't help but to be like, yo, she created something beautiful.
Well, I can't take full credit for that. Someone else, the founder, Leah Gilman, she created that.
So can you tell everyone who is paying attention to this right now, tell us how they can reach out to you, your yoga studio, your doula practice, all of the above.
Yeah, you can go to barefootmovement.com. You can check out the website, see who our teachers are. You can sign up for a class. I'm teaching prenatal yoga, and I teach other classes as well. Yeah, and it's been helpful for me as a teacher who needs to give to
Mm.
be able to be in that role. And I know that that's the case for all of our teachers. As far as the doula practice is concerned, yoga, you can contact Barefoot because we have a couple of doulas on staff as prenatal teachers, and so you know people are sending their request for a doula through that, and you find us.
Okay,
So,
perfect.
yeah.
Thank you so much for all these lessons and for holding space. I appreciate you so much. And folks, when you go to take any of these classes, be prepared for how much life she's going to give you. So thank you for joining us and thank you for sharing.
Thank you.